have you join us on today's episode of Health and Environment Insights. I am Kemi Adeniyi. On today's edition of the program, we'll be looking at the topic, dirty habits to avoid. You know for a fact that there are some habits that are just not good enough for us to have a healthy environment and also a healthier life. On today's program, I have a guest with us today in the studio. I have Dr. Belela Dolani. He's a special assistant to the special advisor on health to Ondo State Governor, His Excellency, Honorable Dr. Lucky Orimison Ayedatiwa. Dr. Belela, it's good to have you on today's program.
Thank you very much. I say good morning to you.
Thank you very much for coming as well. Thank you.
Very much.
And so I'd like you to enlighten us on what dirty habits are. When we say dirty habits, the habits that we need to avoid, we need to know what they are before we begin to avoid them. What are dirty habits?
Thank you very much. Let me start by saying that the word dirty itself means something unclean, something ungood, and something that can definitely not speak beneficiary to the health and even the environment. And when we're not talking about habit in itself, I would say habit simply means a recurring, often unconscious pattern of behavior that we acquire or develop through repetition. It could be good, it could be bad, it could be in between, either here or there. But when you say something to avoid, definitely means bad, non-beneficial habits that people do practice unconsciously often, that can lead to not having good physical health, mental health, or even reduce productivity of such individual. So these are dirty habits that we must try to avoid. It could be personal, let me say this. It could be personal, it could be environmental, and by the time we delve into this, we think out more examples of such things.
All right. I know that you're a medical doctor, and so going by your experience in your profession, what can you enumerate some habits that you tag dirty that we all can learn from so we can desist from doing them? And you explain several examples in the course of this.
Thank you very much. Let me start with the word, what I refer to as personal habits. That is what individual does.
All right.
Often unconsciously. When you have an individual that does not practice regular washing of hands, then that needs to avoid. Because really in an environment that we find ourselves, at a time like this, even right from the time of COVID, we find out that
we were washing hands regularly.
Often we were singing it like song. And I also saw some of the advert that you played on Lassa Fever now to see that people were washing their hands. Because the truth is that if you don't regularly wash your hands, you transmit infections. You transmit infection from one place to the other. But don't, like we say, the health sector, the bacteria, the viruses don't fly. They don't jump. But you can carry it from one place to the other with your hand. So if you wash your hands on a regular basis with soap and clean running water, definitely you are avoiding a lot of diseases. The attitude of not taking your baths minimum once in a day, preferably twice in a day, and having your teeth brushed every day, these are good habits. And if you don't do it, it makes it bad habit that you have to avoid. And also the attitude of, take for example, buying fruits, vegetables unwashed. And I also want to stress in particular for those that are in hospitals, healthcare workers. We advise them that when you move from one, before you get to attend to a patient, you wash your hands. As soon as you're through with that patient, you also wash your hands. By the time you close, at the end of the day, you want to go home, you must wash your hands. And when you get home, before you start embracing your younger ones or your children, you must definitely wash your hands so that you don't transmit infection from one place to the other. That is one. Also, at home, we also advise that people must wash their cooking utensils regularly. You must clean the kitchen regularly. And you must use what we refer to, particularly at a time like this, we must use what we refer to as rodent-proof or rat-proof container. Or to contain, for example, your garri,
to store our food.
To store your food adequately well, so that you don't have them infected. Some people just do it unconsciously. That whatever they want to eat, they just do it carelessly even at home. Unknowing that some of these homes definitely are harboring rodents. And some of these rodents also carry one infection or the other. By the time you deposit such on food, it eats them. And such an individual can definitely come down with diseases.
Alright. I also know that you've mentioned earlier about running water. So what are you implying? Can't we wash our hands inside buckets of water or containers that also have water in them? Is it preferable, or is it a medical advice to wash our hands?
It's always advisable. You use clean running water. Why clean running? By the time you wash, you are not washing it into a bowl that you are going to dip your hand into. Someone can scoop the water for you while you are washing your hand. It's running it over your hand. It's still running, and the water is still clean. Not necessarily you must have a tap in a way. We improvise in an environment that we have find ourselves on this hand. It's still running and it's still clean. Instead of doing it in a bowl and you keep putting your hand in that same bowl, it's like recycling that infection. So that is what I mean by clean running water.
I also would ask you this. There are products, there are beverages that are stored in containers, We have some beverages that are in plastic containers, some in tin materials. But I want to ask you, how true is this assertion that rodents, they most often defecate on those products before we consume them? I want to find out from you. So if we need to consume such products, for instance, if we have to take soft drinks that are in plastic bottles, is it advisable to just buy them or get them out of your refrigerator without cleaning them and just put the bottle in your mouth?
In fact, before you store them in the refrigerator in the first place, it's advisable you must store it clean. The attitude of just opening, putting it in your mouth, particularly there are some. You see, the bottle you're talking about now, you need to remove the cover and put in your mouth. There are some that you need to just open the container and put it directly. Particularly the one that I mentioned secondly now. If you have rodents playing around it, defecating on it, definitely you are eating or you are drinking or you are taking such infection already. So it's always advisable that you must clean, thoroughly clean, and you must also ensure that you thoroughly you safeguard it in appropriate place to save it from being contaminated. It is true. More could be infected by just taking the container and putting it in your mouth. If you have rats, particularly those that are carrying the Lassa virus, like we have seen regularly, and you now start drinking it directly, not even using a clean cup that you have cleaned and put the water in the cup before you start drinking it, you could be infected. It's like an individual buying an orange. Instead of you having it washed, you just decided to open the skin, the cover, and by the time you are taking it, it is almost certain that you will have carried some viruses or some bacteria, and in that you inject it, and you could come down with one disease or the other.
How true is this, Doctor, that there are some cultural and traditional practices that we engage in this part of the world that are actually dirty, that can be tagged as dirty habits?
Let me start with female genital mutilation. It's a dirty habit. Dirty in the sense that if you see the instrument used, the razor used, is a razor that they would have used for a lot of people. And that could carry infection from one person to the other. And I will also say that part of the habit that individually must avoid is using razor that can be used by another person, or sharing items like razor, like tool. If I must come back quickly to the cultural practices that we're talking about, the female genital mutilation is an example that we must run away from. People carry infection, and such an individual that genital has been seriously mutilated. It could be a lot of sequelae will follow. That is a practice that we must run away from. And also cultural practice like some rituals. And you find a lot of things that people throw around, put at what the Yoruba would call Orita Meta, the airballs and the like. These are cultural practices that we need to run away from.
Oh, well, that's some people's religion, and we do it.
It could be decently done. And let me also say that the attitude of the widow now, and you say you want to deny them taking their bath for months or days. They have to use the same black clothes, sleep in the same place. These are dirty cultural practices that we need to run away from. Because individuals can easily contact infections through this. And who knows the type of infection it could be. If it is Lassa, it could be very serious.
I'd like to ask you as an adult that there are people who have spouses and, or maybe people who are in a very intimate relationship that share toothbrush. How healthy is this? Wow. Is this a dirty habit as well?
It is a dirty habit.
I would assume it's an expression of love or intimacy between a couple.
I don't advise couples to use the same brush. Why must you use the same brush? Is that expensive anyway in the first place?
No, it's
so you can use one for the next, just 3 months before you change it. So what is so special about you want to express love? You have various ways of expressing love, not necessarily using the same brush.
All right. We also know that there are people who carry out their market activities in public places. They sell products that are exposed. How healthy is this? Or can we tag this also as a dirty habit? For instance, we buy gari that is put in a bowl and it's just exposed in the market. Some people sell fish that way. Some people sell various edible products that way. Can you explain to us if these are also some form of dirty habits that we should avoid?
Thank you very much. Let me seize the opportunity of this question to say that the State Minister of Health, Environment and Agriculture frowns seriously at exposing food items, exposing dairy, in particular in the market.
All right.
And rice and beans.
I know for a fact that this is going to be a very interesting conversation, especially to everyone listening to this. I'll pause you a little as we go on this break. We'll go on a break now. When we return, the show will continue. Don't go away. Welcome back. If you're just joining us, this is Health and Environment Insights, and our guest today is Dr. Bailey-La Dolani. He's a special assistant to the special advisor to Ondo State Governor on Health. Doctor, before the break, we were discussing the exposure of market products, and you were giving us explanations as to this, if this practice is dirty or healthy enough.
It's a very dirty habit, and I may sincerely need to repeat myself that the State Minister of Health, Environment and Agriculture frown at this seriously, and we're trying as much as possible to do all that are legally possible to ensure that we eradicate this type of marketing or exposing food items. And the reasons are numerous. I will start by saying that by the time we do expose these items, rodents, rats in particular, they play around it. Flies. They screech on it. They pass urine on it. They salivate on it. And if those rodents are the one that can carry, for example, the Lassa virus, such individual will come down. Because often, not everybody uses this gari for ever. Boil the water and but you have people just putting it in the cold water before you know it and soaking it. And some people will come down with Lassa fever. And I also want to appeal that by the time you treat any form of fever, because we commonly commonly cause of fever in this environment is what we call malaria. By the time you treat it conscientiously the way you're supposed to treat it by the medical doctor or the nurses, they give you appropriate drug. And the fever is not coming down. Within 3 days, we must be thinking of Lassa fever, nothing else. At the time like this, we must be thinking of Lassa fever. Because if we cut it on time, it is treatable. It is something that could be managed and such an individual will survive. But if it is late, I think we have late presentation. We have treated it for malaria, you say it's a resistant malaria, you started again, you say it's typhoid, you say it's this and that. And you start wasting time. By the time the symptoms become so enormous, such an individual will come down invariably with Lassa fever and be die. So what exactly am I saying? Actually survival of Lassa fever. Exposing food in the market or on the roadside. Either the poporo or the fish or the gari, whichever one, or maize itself is dangerous. It's a dirty habit that we must run away from.
Okay, I also know that these are challenges and there must be solutions. There are ways to avoid it, because basically that's what we're discussing today. Now that we know some of these habits, how do we avoid them? How do we overcome these challenges?
Like I said habits is a recurring, often unconscious pattern of behavior. And for you to be able to change, you have to take it bit by bit and you follow the rules. Take for example, unnecessary littering of items in the environment. The government frowns at it, and you could hear it being said regularly. You conform, you readjust. You're told to cover the food items you sell in the market. You readjust, you start covering. And attitudes or behaviors, personal, like smoking, which is detrimental to your health, you readjust. You avoid the environment that lure you into it. Excessive drinking. Adventure is when you see your friend that they are taking it, that you are also going to join them in doing it. You try to avoid such a gathering, or you have a way of readjusting gradually. Before you know it, you adjust fully to good behavior. So it is not something impossible in the first place. But
one is intentional about it.
You have to be intentional about it, and it is gradual. And before you know it, you start conforming with good behavior and habits.
Now, going by your office, in what way is government trying to enlighten people about these habits so we can avoid them and have a healthier and sustainable environment?
Thank you very much. Just like I said a while ago, I mentioned the State Ministry of Health, which is also under the Special Advisor to Mr. Governor of Health for now. And we have met with them, we have reviewed most of their activities. And interestingly, the one that has to do with Lassa fever is something that is of great importance to everybody in the health sector in the state now. And we'll talk about it. The one that has to do with this same Lassa fever, you have staff from the Ministry of Health moving from one hospital to the other, talking to them on what they ought to do as healthcare workers. That is infection prevention and control at that level. And when individuals are sick, we also tell them where they should go at the time that the infectious hospital is there. And by the time hospital treats an individual that has fever for 2-3 days, and it's not rebate, it's not coming down, the fever keeps on going, hitting the roof, and the individual is not getting better. Quick referral until you develop a very high index of suspicion as a worker. And by the time you try to manage and it is not working, you quickly refer to infectious hospital. So all these are going on. And we also work with other agencies, other ministries, like the environment that I made reference to a while ago, so that we can continually give information to our people. And invariably, all of us will be in good health and we live happy with the environment we find ourselves. So a lot is going on.
All right, to encourage people, to sensitize them on what to do right, and also to adhere to some of these instructions. I also know for a fact that there are some urban areas where people in residential areas still burn up their waste. What's your take on it? Does this look to you like a dirty habit, or just a way to get rid of their waste? And how is it going to affect our health?
That's not the best way to get rid of the waste. There are designated points that government has made. There are designated routes through which we can pack these items and deposits, and those concerned will go and pick. The attitude of burning definitely pollutes the environment, pollutes the sky. And by the time people inhale polluted air, it has a way of affecting their respiratory system. And before you know it, the whole of the body system will be affected. So we don't encourage such habits of people burning waste. There are designated points that you can throw this waste, and there are designated points that you can package them neatly, put them, and those that are concerned will go there and pack them. And the environment will be clean. The environment must just be clean, because if you don't live in a clean environment,
and it also gets rid of environmental pollution.
Definitely.
Wow. It's been so wonderful. It's been so wonderful speaking with you. And I'm so glad to have you on this show. But before we go, are you discouraging some of us from eating roasted plantain? When next I bring you on the program, that's why you're going to answer that question, because I know you will love to answer that, because a lot of people love the roasted plantain, popularly known as boilie. Thank you very much, Doctor, for coming on the program. On this note, I'll be rounding off. I look forward to having you on the show next week. See you again. It's bye for now.